Hello, everyone. My name is Andrew Chomba. I am part of the team for the Medical Mentor Gym, and today we'll be starting our second year BFAM 2 Pharmacy Practice full lectures, starting with the introduction to pharmacy practice. So, this will simply introduce you to the course itself, the components that it has, the things you should focus on, and the things that you should expect to learn. Of course, as well, helping to see the scope of the full course. Now, let's dive right into it. What is pharmacy practice? So, we can simply say that pharmacy practice is a discipline that prepares pharmacy students for their professional roles within the healthcare system. So, this simply seeks to show you how you fit into the healthcare system. Of course, we have other healthcare professionals that we find in these hospitals and clinics. So this pharmacy practice simply shows you a view of the role that you as a pharmacist are going to play so that you understand your responsibilities and how you can affect the healthcare system and what patients expect from you as a pharmacist. So this course facilitates the integration and application of all basic pharmaceutical, biomedical, behavioral, and administrative and clinical sciences to address pharmaceutical care needs of patients and the community. So you can be in a different way, um, you can be in a different department, but as long as you're part of the healthcare system, whether pharmacy, biomedical, behavioral, administrative, this course seeks to help the integration of all those people in different departments so that we meet the goal, which is to heal the patients and treat them properly. So, pharmacy practice is vital because it facilitates and enables pharmacists to fully exploit their substantial knowledge and expertise in areas such as pharmacology, pharmaceutics, chemistry, and therapeutics within a clinical context. So, all these other courses that you'll be introduced to, that you will learn over the years as a pharmacy student, pharmacy practice is in the middle to connect all those courses. Then, let's talk about healthcare systems. To operate effectively and deliver the best care for patients, a pharmacist needs to understand the way in which healthcare provision to the general population is organized in the country. A pharmacist should be able to comprehensively answer the questions such as: which public and private organizations deliver healthcare to the population? Organizations such as clinics, we have hospitals, we have private clinics, and so on. Which professionals work in which areas to provide such healthcare? Understanding who's found in certain departments. You need to know where the pharmacy is found. You need to know where the pharmtech is found. You need to know your role. You need to know where the nurse is found. What role does the government play in such provision? How do individual patients enter such systems for treatment? How is the patient going to access these healthcare services? Such knowledge should be known by you. Finally, we're going to look at the objectives that will be, a target for the course itself. So this is really like a reference, sort of the things that the course will focus on in this second year. So we're going to be able to describe the role of the pharmacist in the present day healthcare system. Then we'll describe the basic psychological theories and how they relate to the profession of pharmacy. We'll read, rather, we'll learn how to read, and interpret a package insert. Then, we'll learn to be able to retrieve information independently and effectively, demonstrate effective communication skills during interactions with both patients and healthcare providers, describe approaches to responding to symptoms in the pharmacy setting. So, all these things will be covered in basic pharmacy practice in second year. So, that's what we can look forward to. More videos will be shared on these to meet these objectives. Now, what are the course competencies for pharmacy practice? It appreciates the scope of pharmacy as a profession, its history, evolution, its responsibility to society, and its role in the healthcare system, demonstrates the basic elements of effective communication in the practice of pharmacy. It describes the healthcare team and the Zambian health system. It appreciates the role of the healthcare team and the importance of teamwork. This also just a quick overview of the units to be covered. Unit 1, this is like we have started, it would cover the introduction, definition of pharmacy practice, history and evolution of and the scope of pharmacy practice, and among others. So these sort of units are just branched on where all these topics fall. Now, what is a profession? Pharmacy is a profession that requires one to know all there is to know about medicines. Pharmacy is a science and technique of preparing and dispensing drugs. It can also be described as a health profession that links health sciences with chemical sciences and aims to ensure the safe and effective use of pharmaceutical drugs. What are the traits of a profession? A profession like pharmacy. Pharmacy is a profession because it requires a lot of skills, a lot of understanding, a lot of commitment, for you to gain the knowledge and approval that you need to be able to perform the job of a pharmacist. So these are some of the things that as a pharmacist, as a professional, you are expected to be or to do. So you are expected to perform vital societal functions after you attain the profession. So as a pharmacist, being a pharmacist is a big responsibility, and there's a lot of weight to ensure that it is a thing of importance. And nobody can do what you do because you are specialized. You have studied pharmacy, you have taken a lot of time to understand and gather all that knowledge which you are using to respond to symptoms and be able to help clients and patients. So a person can't just come from nowhere and be able to do what you do because it is a thing of importance. It's a profession that requires a lot of time and commitment to acquire. Then, self-regulation. A profession is able to regulate itself. So, in pharmacy in Zambia, we have PSZ, the Pharmaceutical Society of Zambia, which was formed to simply look at how we can regulate the profession of pharmacy, understanding our roles, because the profession itself understands the sort of scopes and jobs that, and also struggles that pharmacy professionals go through. Indeterminate technical knowledge ratio of professional pharmacy. It is a calling requiring specialized knowledge and often long and intensive academic preparation rather, such as the one you are going through right now. You are going to be in school for 5 years. That's a lot of time. You're going to take to learn so much, and in the end, all that knowledge will be required for you to do your job effectively. Now, what are the characteristics of a profession? It determines its own standards of education and training. Student professionals undergo an extensive training and socialization process. Professional practice is recognized by some form of licensure. Of course, for a pharmacist to be able to practice, you need a license. Then, licensing and admission boards are run by members of that profession. You're going to have a license, of course, from HPCZ, but then for you to be able to operate, you also need to write an exam that is run by PSZ, and you gain approval for that so that you can be able to operate. The legislation which affects the profession is shaped by that profession. So pharmacists make the laws and the rules which pharmacists operate in. A profession gains an income, power, and status and can demand increasingly higher caliber students. The profession is relatively free from lay evaluation. The norms and practice enforced by the profession are more stringent than legal controls. They have a powerful sense of identification and affiliation within their group. A profession is likely to remain a long life occupation. Now, let's talk about pharmacy as a profession. Pharmacy is a profession that requires to know all there is about medicines. Also, there are synthesis or isolation, formulation principles of dosage forms, that's pharmaceutics, the compounding or manufacture of drugs, their control, their distribution, their benefits and risks, their therapeutic use, and also their pricing structure. So this is simply the things that a pharmacy as a profession is about. Also, there's the abilities that are required of a pharmacist: thorough knowledge of medicines and their actions, the ability to develop and conduct a drug manufacture program, ability to develop and conduct a drug procurement program, an intimate knowledge of control procedures, distribution, quality, and regulatory control of drugs, ability to develop and conduct drug information services, ability to conduct and practice in research and development, the ability to manage and administer pharmaceutical services. 7-star pharmacist. So this is simply talking about the sort of abilities which a pharmacist should display, and they are called stars. Here there are 7 that are listed, but there are more of what a pharmacist needs to be and continue to be in the profession. So one, you are a caregiver. The pharmacist provides caring services, whether these services are clinical, analytical, technical, or regulatory. The pharmacist must be comfortable interacting with individuals and populations. The pharmacist must view his or her practice as integrated and continuous with those of the healthcare system, and other pharmacy services must be of the highest quality. Then you're also a decision maker. As a pharmacist, you hold the lives of people in your hands. Someone may prescribe, but through your knowledge of the drug, you are able to say, after evaluating the patient, also asking what they are feeling, what they're going through, you can make a decision to say, this drug is too much. Or if you know certain drug interactions that the person who prescribed the drug was not aware of, have the ability to revoke that medication and advise the prescriber to do something different. So it's an important job. You're a decision maker. And then the appropriate, efficacious, and cost-effective use of resources is also advised, because you are responsible for attending to many people. From they have different levels of income. Others are able to um, acquire medicines of different prices. Others can afford the most expensive. So you need to be able to make the right decision to give them what they can afford and what is good for them, what is potent enough to treat what they are ailing from. Achieving this goal requires the ability to evaluate, synthesize, and decide upon the most appropriate course of action. Then you're also a communicator. In this course, you're also going to learn communication skills, which will give you knowledge on how to interact correctly with different people and the sort of information that you need for you to do your job effectively. So the pharmacist is in an ideal position between physician and the patient. As such, he or she must be knowledgeable and confident while interacting with other healthcare professionals and the public. Communication involves verbal, non-verbal, listening, and writing skills. These will be talked about more in a later segment called communication skills. You're also a leader. Whether the pharmacist finds him or herself in multidisciplinary, e.g., a team carrying situations where you have the other professionals who are requiring your knowledge so that the right medication may be given, or in areas where other healthcare providers are in short supply or non-existent, where you are just alone as a pharmacist needing to make those big decisions, he or she is obligated to assume a leadership position in the overall welfare of the community. Leadership involves compassion and empathy as well as the ability to make decisions, communicate, and manage effectively. You are also a manager. The pharmacist must effectively manage resources, human, physical, and information. He or she must be able, or rather must be comfortable, being managed by others, whether an employer or the manager, leader of a healthcare system. You must be able to lead others properly as well as be led, be in a situation where there is someone above you in rank and you are still able to work properly in that situation. More and more information and its related technology will provide challenges to the pharmacist as he or she assumes greater responsibility for sharing information about medicines and related products. You should also be a lifelong learner. It is no longer possible to learn all one must learn in school in order to practice a career as a pharmacist. The concepts, principles, and commitment to lifelong learning must begin while attending pharmacy school and must be supported throughout the pharmacist career. Pharmacists should learn how to learn, continue learning because we have new drugs that come on the market. We have new researches that are conducted so that pharmacists have carried knowledge on sort of the drug interactions that they should be aware of and many other things. So continue learning throughout your career. You can also be a teacher. The pharmacist has a responsibility to assist with the education and training of future generation of pharmacists. Participating as a teacher not only imparts knowledge to others, it offers an opportunity for the practitioner to gain new knowledge and to fine-tune existing skills. So there will be other people who would desire to become pharmacists. You as someone who is already ahead can spearhead that program. You can gain knowledge, academic, qualifications on how you can lecture others and lead them through the profession. Then the last one is researcher, involvement in research and development of pharmaceutical care provision. The pharmacist must be able to use the evidence base, e.g., scientific pharmacy practice health system effectively in order to advise on the rational use of medicines in the healthcare system. By sharing and documenting experiences, the pharmacist can also contribute to the evidence base with the goal of optimizing patient care and outcomes. As a researcher, the pharmacist is able to increase the accessibility of unbiased health and medicine related information to the public and other healthcare professionals. So, this concludes our first lecture. Um, Thank you very much for listening. Please join me for the other lectures as we dive deeper into second year pharmacy practice. Thank you for being part of thank you for being part of Medical Mentor Gym. Please don't forget to subscribe and share the video to others. Goodbye.